Hello, my name is Anya Shaftel with the Washington State University team, working in collaboration with the Extension Collaborative on Immunization, Teaching, and Engagement, or EXCITE. This is the second of the three motivational interviewing modules as part of the Getting to the Heart and the Mind of the Matter Toolkit. There are many other modules for you to use to help you learn from the toolkit. You can watch any of our other videos about motivational interviewing, science media literacy, or neuromarketing by clicking the link to each of the modules in the description. And now, if this works. Okay, there we go. And now me and my colleague, Dr. Pamela Rose, will introduce ourselves before we jump into the content of this module. As I mentioned, my name is Anya Shaptal, and I'm the author of the motivational interviewing portion of the toolkit. I'm also a research assistant professor of special education at WSU and a licensed psychologist. I've been working as a motivational interviewing practitioner since 2006 and as a member of the International Motivational Interviewing Network of Trainers since 2008. In my motivational interviewing career, I've worked in healthcare settings, community mental health, schools, vocational rehabilitation, and universities. And motivational interviewing is something I'm really passionate about. So I'm excited to talk to you all about that today. Just a couple of other things to know about me. I'm originally from Russia, so if you hear an accent, that's where that's from. And sometimes I stutter, so you may hear that as well. And now we'll let Dr. Pamela Rose introduce herself.
Thank you, Anya. Yes, I'm Pamela Rose. I grew up in Minnesota, but my extension career has been a very rewarding career. Right now, my role is to serve as a research consultant for the WSU EXCITE project, providing that expertise and background about the extension system to the team. My extension career was a 35-year plus in various positions. I worked at the county level in 4 different counties, 1 in Wisconsin and 3 in Oregon. So for over 25 years, I've got the experience at the county level, both in urban and rural settings. Most of that, actually all of that career was in the 4-H youth development field and working on behalf of helping young people. But I also served as an extension specialist and finished my career as a 4-H program leader in basically an extension administration type position, providing overall guidance and leadership for the 4-H youth development program in Oregon. So I am a retired emeritus professor with Oregon State University, but have been really enjoying providing this consultant work for WSU.
So Pamela, thank you so much for this introduction and sharing with us about yourself. And we're going to go ahead and jump into the module 2 of the 3 modules on motivational interviewing. This module is, and it just jumped ahead without my prompt, is on motivational interviewing strategies. If you're interested about what motivational interviewing is or specific skills or components of motivational interviewing, please refer to the first module in this series on motivational interviewing. In this module, we are going to talk about 2 specific MI strategies: ask, offer, ask, and assessing readiness. You can find a description of both of these in the toolkit. Ask, offer, ask is on page 34, and assessing readiness is on page 37. So I'm just going to go ahead and jump right into what these are. So ask, offer, ask is a strategy that allows us to provide information to a community member while staying in motivational interviewing spirit, right? So as a reminder, motivational interviewing spirit is partnership, acceptance, compassion, and evocation. Ask, offer, ask also provides us with an opportunity to evoke and reinforce more change talk from a community member. So that's its second benefit. And the third one is that it helps us to avoid the writing reflex. As we talked about in the first module, that writing reflex is when we start to offer information or advice that is unasked for and can create interpersonal discord, which would stop any kind of a productive conversation. Ask, offer, ask actually supports the person's autonomy and reduces the interpersonal discord. So I will explain what the strategy looks like, and then Pamela and I will demonstrate it. So the first step of ask, offer, ask is asking the person what they already know about the topic. Right? We really want to support their knowledge. We really want to affirm that they've done their research or they have looked into this topic before. They're not coming into this conversation as a blank slate. So we ask them what they know, and then we reflect and affirm what they share with us, right? So that is the first step of ask, offer, ask. Sometimes when I talk to folks and I ask them what they already know about the topic, what they share with me is misinformation or is not accurate. It's still important, even in that instance, to affirm and reflect that they have looked into this topic, that it is important for them to find out information, right? Again, that reflection and affirmation are key. And then we ask permission to share more information, right? So this is our opportunity to provide accurate information or additional information or advice to the person. Asking the permission supports their autonomy because they can say no. They can say, I don't want to know any more information. I got it covered. And if they say no, then we just step back and we thank them for that. And then we move the conversation along a different line. We do not want to push and say, well, but it's really important that I share this information with you, because again, we're just going to escalate the interpersonal discord. If they say no, then we just move on to something else. They say yes. And in my career as a motivational interviewing practitioner, I'm sure somebody would have said no at some point. I just don't remember it. When we ask somebody, hey, would it be okay if I share something with you? We as humans are generally primed to say, yeah, okay, sure, why not? Right? So if they say yes, we offer one piece of information. So we really want to be discerning about what that is, because this is our one shot to do it. And we only offer one piece of information because our brains can really only absorb one piece of information at a time. So we share that and we keep it short and sweet. And then we ask the person what they think about that, how that fits in with their life or their goals. Asking that is evoking change talk, right? Like, and then it also helps that person to integrate the information that we just shared with what they already know. Okay, so as a summary, ask the person what they already know, reflect, affirm, ask permission to share more information, share one piece of information, and then follow up with how this fits in with the person. So Pamela and I will do a short demonstration of the ask, offer, ask strategy. Are you ready, Pamela?
Yes.
Okay. As we are engaging in this, you can keep track of effective questions or reflections that I'm using in this conversation with Pamela. All right, Pamela. So what would be the topic of our conversation today?
Well, I've been hearing a lot about my friends. I think a lot of my friends are now in the age group of getting a shingles vaccination. And it has me pondering whether I should be doing the same thing and when. And yeah, so part of me, is thinking I should do that because I'm kind of a proponent of, vaccines, and I think that's a good thing. I know my mother actually had shingles, and I know it was not very pleasant for her. So that's kind of a motivation, but I'm also, a little hesitant because I'm really not that familiar with it. And I'm a little hesitant of what that means for my body and my reactions to it and all those kinds of things. So I guess that's kind of where I'm sitting with that.
Yeah. So as you're thinking about the shingles vaccine, you've done your research, you've talked to your friends, you have experience with knowing people who have gotten the vaccine, and then you still have some worries and reservations, specifically about how that would affect you. Because I mean, I'm just going to make an assumption that you don't want to get sick, or you don't want to feel worse than if you got shingles.
Right.
Yeah.
Yeah. Yeah.
Yeah. So let me ask you, Pamela, what do you already know about the side effects of the shingles vaccine?
All I really know is just the ramifications that my friends, they basically, they were tired, they were a little sore, I guess just some, basic, um, nothing terrible. But really it's just their experience. So that's really all I have is kind of what worked for them, and seemed to be okay for those of my friends. So that's pretty helpful.
Yeah, absolutely, right. And so it's important for you to actually know what the lived experiences are of people who are getting the vaccines, and the people who are close to you. So you took the time to ask them and to find out what it's been like for them, because you want to be informed about what the side effects may be. So that's great. And so I have a thought of things, or the one thing that has been helpful for others in making up their minds on whether or not they want to get the vaccine. Would it be okay with you if I share that?
Yeah. I'm open to more information because I think that might help me make a decision.
Sure. Well, great. So, right. So, alongside with talking to folks who are close to them, other community members with whom I've spoken said that going to the extension office and getting some information, or going to their doctor's office and asking some questions, or the scientific literature on the side effects of the shingles vaccine, has given them some more information and confidence in following through with that. How does that sit with you, and what might or might not work for you?
I think that'd be helpful. I guess I'm usually one that typically when it's my body that I do try to get more information. So I think if I can find some reliable information out there from extension or a doctor or somebody, I think that would help. I just probably haven't taken the time to do that yet, and that's probably the next step I need to do in order to feel more comfortable.
Yeah. So okay, so that seems like that fits in pretty well with what you might want to do. And you've mentioned that might be the next step. Is there like a timeline that you think that might be workable for you, or it's something you still want to hold off on?
Yeah, I think I have a little time to make the decision yet. So I guess I'm not feeling pressed like I have to do that like in the next month or two, but it probably is something I should put on my radar in the next, 3 to 6 months or something.
Okay, so yeah, you're going to schedule an appointment with a doctor or the extension office in the next 3 to 6 months to just find out more information. Yeah,
Yeah,
that sounds like a great plan.
sounds reasonable.
Yeah. Okay, Pamela. Well, thanks so much for talking with me. Appreciate the time.
Thank
And
you.
good luck with that. Yeah, and scene. So that was the demonstration of ask, offer, ask. As you notice, when I heard Pamela say, "Oh, the next step," that to me it plugged this thought about, oh, change talk. She's thinking about the next step, and that's why I followed up with that question to kind of get um, more concrete planning done around when she might find out more information about the vaccines. So I just want to say that was that additional question that is not on the ask, offer, ask list. But what I'd like for you to do is to invite you to engage in a reflection exercise. So you can pause this video and think about what change talk you heard from Pamela when I was talking with her, and how I responded to that, and if there was anything effective. And you might want to jot down those examples. So you can pause the video, do that, and then when you're ready, come back. All right, welcome back. Now we're going to talk about assessing readiness. That can be found on page 37 of the toolkit. Assessing readiness is an important strategy because it helps to engage the person in a conversation about a specific topic. It facilitates evoking the person's own reasons for change, and it supports a collaborative conversation about their goals, past successes, and strategies to overcome barriers to change. And so how we do that, we ask the person on a scale from 1 to 10, with 10 being not ready and 10 being very ready, how ready they are to try something new, try something different, to follow through with a goal. And then when they give you the number, asking the person why they are as high as that number and not lower. And this is key, because asking why they're as high as something is helping us to evoke the change talk. Even if somebody says they're at a 2, they're not at a 1. So there's something in there that is helping them feel a little ready. So asking them, why are you as high as a 2 and not a 1? Or why are you as high as a 6 and not a 4? Would get the change talk flowing. We want to affirm and reflect, of course, anything that the person shares with us. And then asking them what would help them feel a little bit more ready to engage in this behavior or this change. And I say a little bit more ready, like maybe a notch or 2. So we're not saying, oh, you're at a 2. Great. What would help you be at an 8? Oh, that's a big jump. So if somebody is a 2, what would help you feel at a 3 or a 4? If they're at a 6, what would help you feel at a 7 or an 8? Because that kind of question is going to elicit the thinking about next steps and planning and thinking through any obstacles that might get in the way, right? So conversation might sound like, well, I would be at a 7 if I didn't have to wait for 3 months to get into my doctor's office to get information about the shingles vaccine. Well, right, then you can have this conversation about, okay, what else can you do to get that information if that is an obstacle, right? So this is the primer for ongoing conversations, and maybe using ask, offer, ask as a strategy in the middle of it too. And then once you're done with that conversation, you summarize and you highlight the change talk that the person has shared with you. An example of this, again, is in the toolkit, and you can refer to that at your own time. So what we talked about today, what was on our agenda, was talking about ask, offer, ask, and assessing readiness. We covered that. So this is the second module. If you're curious about other topics about motivational interviewing, like what it is, or some of the other components of MI, you can refer back to the first module. And the next module, the third module, will be about the use of motivational interviewing in group settings. We thank you for watching and learning with us today. Again, we'd like to thank the Excite Foundation through the interagency agreement with the USDA, the National Institute of Food and Agriculture, and the Centers for Disease Control and Prevention for funding this project. We hope this toolkit is helpful to you and your communities, and have a great rest of your day.